So before we start discussing UK legislation, we'll notice that while we're discussing the different legislations, there'll be multiple references to radiation dose, and also the limits for the doses are expressed in certain units. So before we get started with the whole topic of legislation, we're just going to look at what are the doses and units by which exposure to radiation is measured. So, as we already know, there's a variety of radiations which are used for diagnostic radiology. The ones which will cause the most, which we are most concerned about in terms of biological damage are X-rays and gamma rays, as well as the nuclear radiation from radionuclides. So, what is important for us to know is that depending on the type of radiation which is being used, as well as depending on the tissue which is being affected, the biological end result of the radiation is slightly different. So, in order to have an accurate estimation of what is the effect of the radiation on the human body, we need to look at certain terms, which we're going to go through right now. So one of these terms is linear energy transfer. Now, this is a term which describes the sum of energy deposited in tissue per unit path length by the radiation. And as we can see in the table here, the different radiations have different linear energy transfer. So the radiations such as X-rays, gamma rays, and beta particles, which are nothing but electrons, have a low LET, whereas more massive particles such as alpha particles and neutrons have a higher LET. So, and this is something that we'll take into account when we look at the effect of these radiation on the body. Another important term which is useful for us to know in this regard is that of radiation weighting factor. And this just describes what is the energy deposited by a certain type of radiation. So as we notice here in this table, X-rays and gamma rays have a radiation weighting factor of 1, whereas, and then it goes all the way down to alpha particles, which have a radiation weighting factor of 20. So it's just a way of quantizing what is the effect that the radiation is going to have. And it's a ratio that they're describing over here. So the reference that they use for establishing this unit is that of the X-rays. And they're saying, compared to an X-ray, how much of this radiation is required to produce a certain biological effect in the body. So this is one important term to know. And then we move on to the units and the terms that we use to describe dose, which is just exposure to ionizing radiation. So one term you'll be familiar with from our matter and radiation chapter is the absorbed dose, which is the energy absorbed per unit mass of the material, and it's measured in gray. Now, we absorbed dose does not take into account the type of radiation which is being used or the type of tissue which is being affected. And in order to consider both these factors, we need to come up with some new terms. And these terms which we're just going to look at are the terms which will actually be used in the legislation to describe exposure. So these are very important to know. So the first is equivalent dose, and this is given by the formula, absorbed dose into the weighting factor. So what this equivalent dose is going to do is calculate so if we're just looking at absorbed dose for X-rays and for neutrons, for example, that wouldn't be, if you're just looking at the absorbed dose, that wouldn't be a good estimate of what exposure the patient is having. But once you take into account the fact that the two types of radiation are different, that's when you use something called the equivalent dose. And although the unit is actually the same as the absorbed dose, in order to make a distinction between the two, the unit that we use is the sievert, as we already know. Now, the second most important term that we are going to look at is the effective dose. Now, effective dose is calculated by taking a summation of the equivalent dose over the entire body. So what you'll do is, for each tissue, you look at what is the weighting factor for the radiation, as well as how is this organ affected by the radiation, and then you'll sum that for the entire body, for every tissue in the body, in order to get the effective dose, which is sort of telling you what would be the effect on the patient's body or the staff's body if this person was exposed to a uniform full body dose. So this just gives you like a quick and easy way of setting dose limits, that is doses over which patients should not be exposed, etc., because it can be quite hard to define, where is the if you're working with just individual body parts, it's quite hard to set safety protocols in place. So this is effective doses for measuring the whole body uniform dose, and this is the way that it's measured. So let's keep moving. So just to summarize what we just discussed, the absorbed dose or the KERMA is the energy deposited per unit mass of tissue, and it does not consider radiation type, and it does not consider organ radiation sensitivity, and the unit is the gray. The equivalent dose is the absorbed dose into the radiation weighting factor. It does consider the type of radiation and the difference in its effect on the body, but it does not consider the separate radiation sensitivity of the organs, and it's measured in sievert. And then the final quantity that we looked at was the effective dose, which is a summation of the equivalent dose into the weighing factor for the tissues in question. And it considers radiation type and radiation sensitivity, and its unit is also sievert. Okay, so that's just a little background knowledge that we will keep in mind while we're going through the legislation. So one thing that's good to note at this point is that since, as we saw, the radiation weighting factor of X-rays and gamma rays is 1, for these X-rays and gamma rays, the equivalent dose is equal to the absorbed dose, because as you can see in this formula here, the WR quantity would just be 1. So that's something that's useful to note in terms of X-rays and gamma rays.